I'm going to actually take you back quite a bit further than that, because you really have to see my career in the context dating back to the 1980s, through many decades of an extraordinarily busy and successful clinical and academic practice. So you have to be able to understand the evolution of my interest in orthopedics and how I was driven to be able to appreciate the magnitude of what I did 7.5 years ago when I said, I'm leaving hospital practice to do something else. When I first started my practice in the early to mid 1980s, you have to bear in mind that there were very few foot and ankle specialists in the world, let alone in the United States. There were only 3 fellowship opportunities in the early 1980s. Now, here in the US, there are 74 positions available out of 56 fellowship programs. So, of course, things have changed. When I began, of course, there was so much to learn and so much to do, because it was a fertile ground for research, ideas, new techniques, to be creative, to be innovative. And I approached that with a tremendous passion and enthusiasm. Along the way, I was obviously fairly driven. I was quite successful academically, wrote a lot, published a lot, and I had a very busy tertiary level practice. Now, you've got to understand that how you can continue with that almost indefinitely. I have many different personal interests, which we can talk about later, but having been so busy, you've got to be very careful that even the difficult procedures don't become routine. And that is, I think, that a trap that many of us fall into as busy orthopedic surgeons, is to avoid the mundane and avoid the routine. In 1990, I started an international fellowship. I'd had the US fellowship already in process for about 3 years. And I felt this was very, very important to open my experience as an immigrant to this country to others. And I did so, and it was fairly successful. And then in 2000, I started a foundation specifically for the education of international surgeons. That foundation ultimately became what we know today as Steps to Walk. Along the way, I'm going to go back 15 to 20 years now, I started with humanitarian service, and I realized how much pleasure and gratification I got personally, quite apart from the joy that you were bringing to patients around the world. And this became more and more important to me until one day I had this epiphany where I said, you know, I'm going to do a lot more of this. And shortly thereafter, I said, this is where I'm headed with this next phase of my career. And that took me to a completely different sphere of life. You know, think about, on the one hand, in the month of May, I was doing 25 to 28 surgeries per week, seeing hundreds of patients in the clinic, and then 1 month to follow, nothing. But it's remarkable. I was actually busier than I was when I was in clinical practice, partly because we as surgeons, we are not geared to think as a businessman. And indeed, while you may consider me a humanitarian surgeon, I still had to organize and create an enterprise which could fulfill our mission and our vision. So that change, that transition was very important. I think that as the programming and our organization became much more sustainable and solid, of course, I began to appreciate the magnitude of what I had done and what we as an organization were able to do and accomplish. So, you know, here I am today, 7.5 years after starting Steps to Walk, and my life is very, very different, but it's extraordinarily fulfilling to be able to run this humanitarian organization, have a legacy of that sort, but at the same time, I've been able to continue with education and some aspects of academic medicine at the same time. So all in all, this has been a very interesting transition. You have to answer that in the context of who you are and where you are. Where are you practicing? Are you in a university hospital setting? Are you in a private clinic or an institute setting? Are you working in a part of the world where you have access to implants? Patients have access to you, where you're able to take advantage of the tremendous changes in medicine, and of course, in this case, orthopedics and in the foot and ankle. Put that, however, in perspective, where you probably are not aware that in the world today, there are approximately 350 million surgeries that are done annually around the world. But only 5% of those surgeries take place in the world's poorest countries. So you've got this incredible volume being done in the Western world, where the younger surgeons have access to everything. You know, they're in theater, they see, everything is available, everything that they need is available. Things tend to work efficiently. You're doing a surgery, and well, your turnover time between surgeries is 30 minutes, maybe less, sometimes maybe a little more. Imagine the shock that I had when having to deal with 2 hours of turnover time in many parts of the world, where instruments, equipment, implants are simply not available. So the mantra that we have as an organization is, you've got to learn to do more with less. Now, how does this apply to your question? Change is inevitable. If I were to limit my answer to what I think is going to take place in the world of foot and ankle as we see it, and perhaps as your younger surgeons and registrars see it today, it's not going to be in the realm of plates and screws. We're done with that. When a new plate comes on the market, it's all me too. There's nothing terribly different. Obviously, these are maybe better in the sense that they're anatomic. We're able to use them very well. There are systems available for us. But after all, it's a plate and screw. So where are we headed in the modern world of orthopedics? I'm not going to now anyway cover the rest of the world, because I think that a lot is going to involve biologics and understanding the transition between 2D, as we see on an X-ray, to 3D and 4D. Our understanding and implementation of AI in what we do is going to be very, very important in the future. I am certain that there will be AI models for just about everything, making the life of the surgeon much easier. I think we have to be a little careful with that, because therein are recipes. If I, as a surgeon, I may be a competent surgeon. I'm not talking about myself personally, but I, as a surgeon, I see, oh, there's PSI, patient-specific instrumentation, or as we're headed to AI development of techniques, guides for doing certain procedures. These are recipes, and while it takes away a lot of the guesswork, that guesswork is terribly important, because I genuinely believe that you have to always be a little bit outside of your comfort zone in order to improve your skill set, in order to advance your knowledge base. You must not stay terribly confined within your GPS. I've always said to my fellows, you need to learn to lose your GPS. And that indirectly definitely applies when we think about AI and PSI and new models for the foot and ankle. Having said that, I still think that those will be where we will see the biggest advances in the next certainly 5 to 10 years. I don't know what will come after that. Cheaper, I think, is very important. We see things because we have access to everything, but we don't necessarily think about cost. You have to think about that in the rest of the world. How much will this implant cost? Maybe, we're used to very sophisticated screws and plates and implants. What if all you had were pins, and you had nothing else but pins? Well, you'll make it work. You will make it work. You will have to make it work. And therein, is the sense of, well, we've gone in this this full circle, and back to basics, learning to do more with less. And I think that's probably where I see the biggest changes. So when I think of a difficult surgery and how it has changed me, or how it changed me at the time, I don't want to think in terms of a particular procedure or a particular surgery. I'd like to look at it a little bit differently. During my career, most of my work was in the adult realm of adult reconstruction, but I loved taking care of children and pediatric deformities. This was always very, very different. Now I'm thrust into an environment over the past 7 years where 70% of what we do is in kids. And the first time I was confronted by unimaginable deformity, which really we do not see much, if at all, in the Western world, that is routine for us on these humanitarian programs, and realizing, well, if I didn't do it, no one was going to do it. And yes, it really took me out of my comfort zone. And I recognized that there are principles of what we do with all types of reconstruction. So, for example, we're used to managing a drop foot or a paralytic foot where the foot is twisted inwards, an equinovarus deformity. We're not, and we've seen hundreds of those and treated so many that it's routine. But we don't think of the exact opposite deformity that we see in children. Let's say a calcaneovalgus deformity associated with myelomeningocele or some other cause. And when confronted with this, you close your eyes and say, what am I going to do here? But the principles are the same. Even if you've never seen it before, you can still initiate that care just by following rules, your own rules. Now, it'll take you way out of your comfort zone, but that is what brings me tremendous joy, excitement, passion for what I do, and keeps me going, is constantly now doing new things, being challenged all the time by very different deformities, which are also humbling. There's nothing worse as a surgeon to be arrogant and overconfident. And unfortunately, I'm just as guilty of that as other surgeons. When you're on a roll with a very successful academic career, I think that there is inevitably those circumstances where you are a little arrogant and you do push things. But humility is something that I've really learned as a result of these terribly challenging deformities, and perhaps also recognizing how privileged we are in the Western world and how much good we can do in the rest of the world, and how globally, how our colleagues and patients, how difficult things are. So it's not really a procedure. It's recognizing a class of procedures, and not even recognizing a deformity. I must say that if I were to go back 30 years, treating the flat foot was always easy. You could make certain innovations and you could initiate new treatments, new principles for treatment. But when you're faced with a neuromuscular deformity and the exact opposite, let's say a cavus foot deformity, that you really needed to think a lot more about it. Nowadays, it's absolutely routine because I see so much of this and I treat so many of them. But that transition from being a difficult procedure to one that's routine is a fabulous learning experience, because it's a journey. And you have to be able to confront this journey, as I say, a little bit out of your comfort zone and stay there. Yeah. I've been very fortunate to have many different interests. So in the athletic field, what has changed, I used to be a very competitive runner. I switched to cycling in the late 90s and rode competitively. Of course, along with that comes skiing and golf and hiking and snowshoeing. I live in Colorado, where outdoors is our life. So there's always that aspect of outdoor activities that take place. But there's a lot more to it than that. If I could describe a really perfect weekend, it would include a little bit of reading, not orthopedic reading, a little reading a novel. It would include physical activity. One of the sporting interests and athletic interests that I have other hobbies. I am a gardener and a very avid gardener, so working in my garden is wonderful. I also have a ceramic studio and I do pottery, and that is quite joyful, particularly the transition from throwing something to firing it. So that would be an ideal weekend. It's a combination of a little work and a lot of joy with my family. And being able to do that with my family is terribly important. Yeah. I can't really answer that. I thought about it. I saw your question. I thought, well, how am I going to do that? Let me do it this way. I read a lot. I probably read 2 novels a week. I'm definitely influenced by many of them. I happen to love historic fiction. There's a learning process and a joy with reading, which I enjoy, but I cannot select any particular book that has influenced me. When it comes to movies, I'm not much of a movie goer. I enjoy them, but if I watch a movie yesterday, I couldn't tell you the name of that movie today. So there haven't really been that many that I would say has influenced me, my thinking, or what I do. But reading is different. I think to be able to read from a young age and read novels is so important. I remember many years ago, let's say 15 years ago, I was asking one of my fellows, what has he read recently? And he looked at me as if I was nuts. He said, what do you mean? I said, well, what novel have you read? He said, I haven't read anything. I said, well, when was the last time you read a novel? He said, when I had to in high school. I said, but you mean you've not read a novel since high school and you're now a fellow of mine in orthopedics? Yeah, I read orthopedics. Now, that made me wonder a little. He was a brilliant orthopedic surgeon, very talented. And I used to run every week at my home a dinner lecture. And the fellows and visitors would come over to my home and I would teach them and then I would cook for them. So I love to cook. And instead of the lecture part of it, for a few weeks, we had a book club. And I would not let the fellows read any orthopedics for a few weeks. I made them read these novels. I got the books for them and said, this is what we're going to have a book club. Now, I think that books are very, very important. Novels and history and life all tied in together. Yeah.